Good morning. Good morning, sir. So thank you for the opportunity to present our work. I shall be discussing on the microbial milieu of the post-mortem conjunctival sac. So the human cornea is retrieved from the donor eyes after death, and before collecting we typically put povidone iodine so that it disinfects the cornea. But the protocols for povidone iodine are very different. So we don't know that some organisms survive, how much contact time, every eye bank has their own SOP. And also we noticed that since the almost the last 15 to 20 years, there is no study which enumerates how the conjunctival microbes grow after death. Nobody knows. There is one study in IGO long back in 78, like that. From then there is no idea about how the demographics change and how the microorganisms differ. So with this background, we thought that let us take swabs and understand what are the growth patterns and how it changes after death. That is also important. So after COVID, as we know that the Eye Bank Association of India changed the rules of eye collection from up to 12 hours, 6 to 8 hours was normal in India. So now it changed to up to 24 hours if the body has been refrigerated. So we divided, so with this background, we divided our study into two study parts. So as we know that the cause of infection in the recipient is twofold. One is external, meaning that the skin around the periocular tissue may get contaminated. Second is when there is a decomposition of the body. So the gut microbiota start moving across the whole body. So there is an external source, there is an internal source of infection, and the incidence of infection is 0.2 to 0.7 endophthalmitis after transplant and 6.5 to 10.5% after microbial keratitis after transplant. So this contamination, as I discussed, is both internal and external. External from the skin, Staphylococcus around the periocular skin. Internal is from the gut bacteria. So what we also found in some of the recent papers that we reviewed was that the tissue that is coming to the cornea surgeon is stored in tissue storage medium. It has antibiotics, MK medium, cortisol, but there is no antifungals. But in a hot, humid climate, it is not uncommon that fungi also grow in these conjunctival cul-de-sacs. So should we also supplement with antifungals? So that is again another live question that we are dealing with scientifically. So with this background, the purpose was to study the microbial milieu of the postmortem conjunctival cul-de-sac within and beyond 12 hours of death. So suitable donors from the bodies, we took swabs and we plated them in the culture plates within 12 hours and beyond 12 hours. And then from the colony morphology, we tried to understand whether they are bacteria, fungi, what type of bacteria. From the gram smear, we can make out spore forming bacteria, hyaline fungus, likewise. We included all suitable donors between 18 to 80 years of age and either gender and up to 24 hours of death. And we excluded the common contraindications for eye donation. So drowning, ventilator, septicemia, and likewise. So our baseline demographics in those bodies from where the swabs were taken within 12 hours and those where it was taken beyond 12 hours was similar. So there were 52 eyes of 26 donors in within 12-hour group, 50 eyes of 24 donors in beyond 12 hours group. The mean age, the male age to female ratio was matched. The mean death to preservation time in the early collection group was 7.5 hours and 15.5 hours in those where it was beyond 12 hours. And these were the bacteria that we grow and the fungi. So within 12 hours, we found that there was more hyaline fungus and candida, and the candida ratio was much more in those where the swabs were collected beyond 12 hours, meaning that the odds of a candida culture was more if the body was preserved beyond 12 hours. This is important because then we have to think of preserving this cornea storage media with some antifungal supplementation. These are very preliminary studies, but this was the main conclusion of our study. So thank you very much for